Hi everyone, I wanted to do another video with another example of some landmarks. So I just grabbed another Pano that I could see some landmarks that are going to be on the exam. So I just wanted to show them in another form or in another Pano. So just to go through some areas here. So if we're looking at the inferior border of the mandible, kind of point to it, and I'll give a second pause before I kind of outline it. So the inferior border of the mandible would be this whole area here, coming all the way around. So that's the inferior border of the mandible. If we're talking, if you want to identify the angle of the mandible, you're going to look at this area here. That's going to be the angle of the mandible. So I'm going to kind of do really large, super obvious ones first. Where would you look for the condyle? Here and here. Now take a second to point out the sigmoid notch. Here and here. Now take a second to point out the coronoid knot or coronoid process. It's more obvious on this side here, the coronoid process. It's a little fuzzy over here, but it would roughly be in there. Now take a second to point out the external oblique ridge. Here and here. Okay, good. So now I'm going to erase those so that we don't get too messy, and then we'll look at some other. So now take a second and sort of draw with your finger where you would see the floor of the sinus. Sorry, I'm going to make my line a little bit smaller. Floor of the sinus, so right through here, right through here. It's a little bit hidden over here. What about the hard palate? Point out or trace your finger over the hard palate. That's going to be right through here and right through here. And remember, that's a double real image. So you kind of see two of them, sort of. How about the nasal septum? Nasal septum is going to be right through here. And then what about the nasal spine? Where's that? That's going to be right here, the bottom of the septum. How about the orbit? Where are the orbits? It's going to be here and here. And then let's see if we can find an airspace. I'm going to take this off. And can you see an airspace? Can you kind of draw your finger through an airspace? You can see, if I were to kind of generalize it, you can see the nasopharyngeal right through here, nasopharyngeal, and then you can see the glossopharyngeal right through here. Do you see how that whole area is a little bit darker? So those are the areas. Now, if there was the palatal glossal airspace, which was a mistake, an error of the patient not putting their tongue up to the roof of their mouth, we would see that right through here. I think they kept their tongue up there. The ends of the roots are a little bit fuzzy, but so are they on the mandible. It is a little dark through here, so I feel like it's a little questionable. There might be a palatal glossal airspace there, but those are your air spaces. Nasopharyngeal, glossopharyngeal, palatal glossal. Then let's see, what else can we find here? You can see the hyoid bone down in here. Oh, I keep wanting to ask you before I point it out. Hyoid bone down in here. And then how about, where would the soft tissue of the ear? Can you outline it with your finger on the left side? It's right here is the soft tissue of the ear. And the external auditory meatus is a little bit hard to see, but I would call it right about there. And then the styloid process, I think it might be this guy. It's usually down from the, either that or that's the external auditory meatus. Because that looks awfully low for a styloid process, I have to say. But it can depend on how the patient is positioned. So that could be the external auditory meatus, and that's the styloid process. Okay. So can you draw your finger down along, or point to the area of, in general, where the mandibular foramen would be? The right side is probably a little better because there's less airspace that's kind of blocking your view. So on the right side, where in general would you point to the mandibular foramen? That would be up here. And then do you see the mandibular canal? Sorry, that's messy. But the mandibular canal you can see here and here. Can you see the area that would be the submandibular fossa? Let me get rid of this. Where would you point to for the submandibular fossa? Right through here, it's pretty obvious. It's pretty radiolucent right through there. Submandibular fossa. How about the mental foramen? Can you see the mental foramen on this pano? You can pretty well. Right here you can see it pretty good. And I think you can see it there too. Okay, let's see. What else can we find? This is not my favorite, part at all, but where would you put the zygomatic process? Right about here and in here be the zygomatic process from other examples. It's a little tricky, I think. It's a little tricky. Okay. So again, things like the articulating eminence, you're going to see up around and in front of the condyle. I think actually might be more down here. It's a little bit whiter, like not as white than as what I would think that it would be. Actually, it's a little bit because of the patient. You can see they have a pretty good gentle smile line, which is what we want. But it does seem a little bit like something is a little bit out of place in here. There's an awful lot of white, so it's obscuring some of the bone. But one thing, do you notice one thing though about right in this area? It looks a little dark, so I don't know that the patient had their lips completely closed around the bite block. So I think that's about all that is really standing out to me. I'm trying to see if I am missing anything. I don't really see anything else. But if you guys see something, then that's awesome. But hopefully that kind of helps, just walking you through another pano and picking out some landmarks.